Standard modern fertility treatments rely heavily on systemic intervention. Patients routinely endure complex cycles of injected medications that flood the bloodstream and force physiological responses across the entire body. Over time, this aggressive pharmacological approach creates a compounding physical and emotional toll, leading to severe clinical fatigue for those undergoing long-term reproductive care. A growing subset of patients is seeking a different clinical approach, interventions that operate locally and remain entirely outside the body. One specific protocol entering this space is the Fertility Nourish Herbal Pouch, developed by 5 Essences. In this split-screen diagram, we see the distinction. Instead of systemic dispersion, the pouch applies directly to the navel, the CV8 acupoint. Because nothing is swallowed, it bypasses the gastrointestinal system, avoiding the liver and stomach entirely. The core thesis here runs counter to standard Western pharmacology. Despite never entering the bloodstream through ingestion or injection, retrospective data indicates this purely dermal application successfully supports natural conception. Practitioner records document successes even in highly complex, treatment-resistant profiles, including women of advanced maternal age and those with a history of recurrent IVF failures. How exactly does a topical herbal pack placed on the abdomen influence the internal reproductive environment? Decoding this localized mechanism is critical for clinicians evaluating low-friction, complementary support for patients exhausted by standard medical interventions. The physical mechanics of this protocol prioritize steady, uninterrupted contact. A standard starter package contains 5 separate pouches designed to provide a 15-day therapeutic window. This calendar grid illustrates how the therapy relies on continuous delivery. Each individual pouch is worn for up to 72 hours before being replaced. Dermal contact over the navel is maintained by securing the pouch with a reusable support belt worn comfortably around the waist. The primary physiological objective of this extended contact is to act as a natural hormone harmonizer. Clinically, it targets underlying irregularities that disrupt ovulation, specifically addressing conditions like oligomenorrhea, or irregular cycles, and hypomenorrhea, characterized by scanty menstrual flow. By gradually correcting these specific menstrual irregularities, the localized application works to naturally prepare the body's internal environment for pregnancy. Instead of the sharp daily peaks and troughs inherent to oral medication dosing, this continuous 72-hour dermal application aims to cultivate a stable, optimized uterine environment over time. The theoretical mechanism is supported by a series of documented retrospective case studies from the practitioner's records. The first documented case involves a 34-year-old patient. Looking at this timeline chart, her clinical history shows a severe block, 6 years of reported unresolved infertility. The intervention began with the external herbal pouch routine. The outcome was rapid. Conception occurred approximately 1 month after she started. The second case introduces a higher degree of clinical complexity in a 42-year-old patient. This timeline charts advanced maternal age combined with 5 years of persistent infertility. The friction points involved intense allopathic intervention, specifically 2 unsuccessful in vitro fertilization attempts. Following the umbilical pouch application, the patient conceived and successfully delivered a healthy live birth. The third case involves a 45-year-old patient facing severe reproductive hurdles. Beyond advanced maternal age, her specific challenge was a documented history of recurrent miscarriage. To address this, the practitioner adjusted the long-term protocol. The initial fertility pouch was followed by specialized pregnancy care pouches to secure the gestation period. The outcome matched the intent, successfully supporting the patient in carrying the baby to full term. These specific cases demonstrate the umbilical protocol's ability to act as a catalyst for conception and term delivery, even in aging populations where invasive, high-cost interventions have previously stalled. While these initial outcomes are certainly compelling, we have to pause and explicitly define the clinical boundaries of the data we are reviewing. These records are selected, uncontrolled, and largely retrospective observations reported by patients themselves. Statistically, because the total treated population denominator is unknown, we cannot calculate a broad efficacy rate or predict a guaranteed outcome for another individual. Furthermore, concurrent lifestyle or medical variables were not strictly controlled. Therefore, the data cannot definitively prove that the external pouch alone caused the conception. This therapy does not replace standard diagnostic tools, including ovarian reserve testing, semen analysis, or tubal evaluation. The biological reality remains that fertility strictly declines with age. External protocols should never delay time-sensitive allopathic evaluations. Responsible medical practice views this localized therapy not as a guaranteed cure, but as a complementary wellness tool that must exist alongside rigorous clinical diagnostics. For clinicians or informed patients, the next step is determining how to practically integrate this tool into a modern fertility journey. This bar chart illustrates the dramatic economic contrast. A 15-day course of the pouches costs $149, a tiny fraction of conventional treatments, coming in at 98% less than a single IVF attempt. Looking at this flowchart, we can trace how standard medical care and complementary therapy operate simultaneously. The paths safely merge and run parallel during the early preparation phase for natural conception. However, there are strict contraindications regarding active, prescribed fertility treatments. Because no formal interaction studies exist, the pouch cannot be combined with active IVF medications or protocols without express clinical approval from a reproductive endocrinologist. The protocol also has an absolute hard stop. Usage must be discontinued immediately if pregnancy is suspected or confirmed. Ultimately, this integration presents a clear value proposition for the wider clinical ecosystem. The core mechanic provides 100% external, continuous nourishment that completely bypasses the daily disruption and systemic side effects of oral medications. It empowers the patient with a gentle daily wellness routine they can control themselves, requiring no clinical visits or painful injections. For complex cases facing the severe physical and emotional fatigue of standard treatments, the umbilical pathway offers a highly targeted, non-invasive method to harmonize the reproductive environment while maintaining absolute respect for standard clinical care.